Hello there. Let's look upon the purple urine bag syndrome. We will see the introduction, causes, and one of the abstract I have taken and the two nursing diagnoses on the UTI cases. So let's begin. Purple urine bag syndrome is an uncommon condition seen in the patients with the indwelling catheter, urinary catheter, and urinary infections. This condition is usually benign and requires no further treatment than the bacteria-directed antibiotic therapy. So usually antibiotic therapy will be given to the patients with the purple bag syndrome. Hence, the main points are purple urine is rare and nearly pathognomonic for purple urine bag syndrome. Purple urine bag syndrome is due to infection or colonization with bacteria that convert a urinary metabolite into blue and the red pigments. Actually, the purple urine bag is not purple urine. It is a mixture of the red and blue pigment of urine. So, co-administration of methylene blue causes blue-green urine, and cyclobulamine causes red urine, and that causes the purple urine. So the causes of the purple urine are intestinal bacteria convert tryptophan to indole. In the liver, the indole indoxyl sulfate. Then in the urine, the bacteria which converts the indoxyl sulfate indoxyl, or else the cause can be in the urine indoxyl leads to pigment such as indigo, that is the blue, or the indigene red color. So the interaction with the pigment take place and causes the purple urine. So usually the tryptophan, the major cause of purple urine, causes constipation in the intestines and indole occurs, whereas the liver, which secretes, means that where the portal circulation carries on, indole that causes indoxyl sulfatase, and that indoxyl leads to indigo and indibilirubin. This is just a small pathophysiology that how you are getting the purple urine. This is the abstract on the PUBS. Purple urine bag syndrome is a complication of urinary tract infection where the catheter bag and the tubing turn purple. It is an alarming for the patient as well as for the family clinicians. However, it is in itself a benign phenomenon. No one knows what exactly causes this. So PUBS is the result of the UTI and specific bacteria that produce sulfatases and phosphatases, which lead tryptophan metabolism to produce indigo, that is the blue, and the indirubin, that is the red pigment, a mixture of which becomes purple. The risk factor includes female gender especially. Causes such as female gender immobile patients, constipation, chronic catheterization, and renal diseases. So the management, which involves reassurance antibiotics based on the cultures and regular changing of catheters, which is very essential. Although there are debates regarding how aggressively to treat and no official guidelines for PUBS, but still prognosis is good for the patients on antibiotics, but PUBS is associated with high morbidity and mortality due to the backgrounds of the patient's condition. The two nursing diagnoses I have taken on the UTI case based on the UTI, because UTI is the most common causes the PUBS. So the acute pain related to inflammation or infection of the urinary tract as manifested by verbalization of the patient, like burning sensation on urination, spasm of lower back and bladder area, facial grimace, protective decreased physical activity. The nursing interventions, what the nurse can take care on this diagnosis is planning, assess the client's description of pain, assessment of pain to be done, nature of pain to be assessed, where exactly the pain the patient is getting, whether they have the flank pain or pain is radiating or what. Then factors of UTI, monitor laboratory results, give antibiotics to the patient based on as well as some of the non-pharmacological treatment we can give, like supportive measures for the patient, like heating pads or the cold application, administers analgesics, antispasmodics to the patient, whereas encourage the patient to drink more and more fluids so that the UTI can get easily healed, and instruct the patient to avoid coffee, tea, spices, alcohol, and soda, and administer the medications urines on time properly. Then second nursing diagnosis is impaired urinary elimination related to frequent urination, urgency, and hesitation as manifested by verbalization of dysuria, and patient much urge to go and pass the urine. The nursing care can be assess the patient pattern of elimination such as frequency, dysuria, nocturia. Note the client age and the gender, because the age, geriatric patients as well as the female patients are much more prone to have the UTI and the problem in urine elimination. Instruct the female client to wipe from front to back when they have urinated. Encourage the patient to drink cranberry juice, especially because it helps in reducing the adherence of bacteria. Limit the use of indwelling catheters because that is the main cause for the UTI, such as catheter associated urinary tract infections. So this is how we can plan the care for the patients, especially who have the UTI that causes the purple urine bag syndrome.